Gentleman is recognized for 5 minutes.
Madam Speaker, I rise to, first of all, support the Flake Amendment, but also to oppose the underlying bill and the drastic cuts that will devastate the most vulnerable citizens in our nation. Just to highlight some of these cuts, the bill will cut $25 million from the Ryan White HIV/AIDS program, the AIDS Drug Assistance Program, ADAP. Now, ADAP is a program of last resort for the poorest Americans who don't qualify for Medicaid or Medicare. Currently, there's a waiting list of over 6,000 people in 10 states to receive benefits from this program. $850 million in reductions to the CDC, organization whose first task is to defend us against diseases, infections. $850 million, that's smart. Let's just cut and make America more vulnerable. The bill cuts $1.6 billion in funding for NIH, so I guess we won't need any research since we're going to let the diseases run rampant in America. I mean, it goes so far as to say, in the District of Columbia, we're even going to tell you how to spend your very last dollar. But it gets better. Community health centers, where the most vulnerable are treated for their health, $1.3 billion in cut. Community health centers will lose the capacity to serve 11 million patients over the next year, and well over 3.3 million current patients losing their care within the next few months. The bill cuts $5 billion from the Pell Grant. I did hear that there were a lot of new millionaires elected to the Congress of the United States, so I imagine they can pay for their children's education. But maybe we should think about people that don't have the median income of members of Congress, people who don't make $175,000 a year, which puts all of us in the top 1% of wage earners. What about the most humble and the poorest and those who wish to aspire one day to lead this great nation of ours? Shouldn't they be given an opportunity? Not under this program. Let's cut the program, the basic program that allows young men and women to seek a college education, the Pell Grant. Let's eliminate billions of dollars from there also. But wait, $25 billion the federal TRIO program. That's for first generation. That's the first kid in a family where nobody's gone to college. Let's just cut from that program too. The bill cuts $20 million from Gear Up. And wait, $1 billion from Head Start? Now, I'm just going to end with this. I know, I want the public to understand this. We get great health care here. Excellent health care. It's not free, but we get great health care. About $400, that's what they deduct from my check. My wife gets good health care, my daughter gets good health care, and so do every one of you get good health care. Shame on anybody that would adopt this kind of budget, knowing very well the kind of great health care that the American public. Cut your health care first before you cut the health care of the most poorest, of the most vulnerable in this nation. I regain the balance of my time.
Gentleman yields back the balance of his time. For what purpose does the